came into play. It has indeed been an ideal platform for such discussions to take place where we can learn from each other from one country to another as we are now in a global fight against a deadly virus that requires concerted efforts in overcoming it. So today, we will delve deeper into the effects of the pandemic towards national security and its impact beyond health. As we are learning more and more about the pandemic and the toll that it has on our everyday lives, we are discovering that its threat is not only confined to our health. In fact, a pandemic of such has the potential to weaken societies, of course, the economy as well, and even political systems. For today's first session, we have three speakers who will give insights on the depths and lengths of the pandemic's effects towards security and how we can combat the dangers that it poses. Before I introduce our first speaker, I would like to remind the audience that there will be a Q&A slot open at the end of this first session. But however, you may submit your questions through the Q&A box we have here in Zoom at any time during the presentation. And don't forget to state the name of the speaker you would like to put forth your question to. We'll also have a poll later on where we will want to hear from you, so stay tuned. Ladies and gentlemen, our first guest speaker is Lieutenant General Dato Pahlawan Dr. Mat Amin Muslan, Director of Health Services of the Malaysia Armed Forces. Having a medical degree, he joined the Malaysia Armed Forces and was commissioned as a captain doctor in the Royal Medical and Dental Corps. During his tenure, he was actively involved in military operations and humanitarian programs, including the 2004 Aceh tsunami and the Yogyakarta earthquake in 2006. He was also given the opportunity to serve in the peacekeeping mission under the United Nations in Namibia. It will not be an understatement to say that he is a man who knows how to deal with the crisis. Let's now pass the floor to Lieutenant General Dato Pahlawan Mat Amin.
First and foremost, Nadia, can you hear me? Okay, thank you. Thank you for that very generous introduction. Okay, so before I start, very good evening to those in Malaysia and Guten Morgen for those in Germany. And I would like to say my sincere appreciation to MiDAS and also KAS for this invitation to participate in this seminar. And also I'd like to appreciate my fellow panelists for this first evening session, Colonel Dr. Frank Richter and Mr. Thomas. And as Nadia correctly mentioned, I am a doctor, a public health specialist by profession, served in the Malaysian Armed Forces for the last 32 years. And during my lifespan, I'm lucky enough to see many disasters, face many epidemics and pandemics, and this, I believe, will not be my last. Okay, so let me share the slide that for my presentation today. So COVID-19 pandemic in Malaysia, effect on national security. As mentioned by Nadia, I'm only a doctor. I'm not a scholar in national security. So my discussion today will be very macro and at strategic level, and I will not bore you with the vast topics on virology and also medicine. So we keep the discussion as simple as possible. So this picture shows that what COVID has driven us into. It has created a new level of cooperation among Malaysians as we face this pandemic. A little disclaimer, whatever I discuss this evening will be my own opinion and thought, and will not be an official policy of the Malaysian Armed Forces and also the Malaysian government. But of course, it would have some reflection on how the Malaysian Armed Forces and also the Malaysian government has reacted to this pandemic. First, I would like to quote what Einstein has mentioned: with every action, there's an equal opposite reaction. With every problem, there is a solution. It's just a matter of taking action. I believe this is more appropriate as we discuss the effect of COVID to national security. It's not a linear sort of reaction, a relation. It's a very complex relation because it involves how countries respond to the threat and how the nature of every country is different. What we have done in Malaysia is probably the best for Malaysia to do for Malaysian. It will not be the same as what would be happening at other countries. But today's session allows us to share experience of how Malaysian, especially the Malaysian government, reacted to this threat of COVID-19 pandemics. I'm going to approach it from the way of a SWOT analysis tool. It's a very unorthodox method of looking at how this infection or crisis affect national security. But I believe that by using this analytic tool, we can have benefit from the opportunity that this calamity has brought to us. So there's no doubt it's a pandemic, a massive viral epidemic that affected all continents. It affects livelihood and it can cause us death. So whatever people are saying out there, telling that it's not a pandemic, it's something that is unreal, it's not true. It's a pandemic. Pandemic that arises from a public health crisis. So we have to admit it, that what we are facing now is actually a public health crisis that many nations are facing. So why is it a public health crisis? First, the disease is easily spread. It can cause death, although the numbers is small. Diagnosing is challenging. It takes about 3 to 14 days to diagnose the disease. It has no definitive cure yet. That creates a lot of uncertainties. We are not immune against it yet. Hopefully, the vaccine can help. Available public health control measures are disruptive. I repeat, available public health control measures are disruptive to livelihood and lifestyle. And this is how COVID-19 pandemic affects many nations. The overwhelming and overburdened public health system will make it worse on the health of the nation. And lastly, the uncertainties. There's still a lot more things that we don't understand about this virus. Okay, and that creates a lot of vulnerability in many people. So how does it affect our national securities? All over since February, we have seen many governments taking the necessary step toward this potential crisis. And we also have seen many governments that slow in responding to how they are treating this crisis. So through the SWOT analysis, the public health crisis, what is a threat? It's threatening the population health and public safety. Directly, COVID-19 increases mortality and also morbidity. Indirectly, on health, it's siphoning all the already limited health resources and causes more mortality and morbidity. On the economy, because of the destructive nature of the public health control, it affects the economy badly. And lastly, the threat. Public health measures disrupt social activities and livelihood. And this also affects political stabilities. Many people don't want to be told what to do. And this have created a lot of public perception and public unrest. So COVID-19 as a public health crisis can affect national security, especially when there are weaknesses at the element of power within the nation. So what are the weaknesses? At the international level, unfortunately, when this disease was first identified, the geopolitical situation resulting in the region causes a lot of decline in trust. And because of that, we have not been able to respond appropriately fast enough. COVID-19 is not the first coronavirus that struck the world. We have SARS, we have MERS. We have been able to control and contain SARS and MERS through public health measures. But unfortunately, why does COVID-19, when it happened, that we are not able to garner effective measures to contain it at the point of origin? This is the time also we have seen a lot of decline in multilateralism. We have dominant nation or dominant state playing into many effects, and we have seen narrative of disinformation and misinformation that actually confuse public response when this outbreak happened. The disinformation and misinformation not only undermine WHO, but it also delayed the effective international effort to contain the virus and the disease. When the disease was first found or identified in October 2019, many nations only reacted to it somewhere within February or March, or much worse in April. So there is a lot of delay that we have lost to prepare the nation when COVID-19 arrived. At the national level, at Malaysia, COVID-19 happened at a time there is a political challenge in the country. There's a lot of trust and there's a lot of mistrust. COVID-19 not only a problem as a disease, COVID-19 is also being used as a political tool for certain interest groups. The Malaysian challenge public health system is already not at its best when this thing happened, especially in areas where public health system is a little bit challenged, especially in the Kalimantan or Borneo states. Crisis management system need to be upgraded. And at times, we are not that agile because in Malaysia, we are so used to managing floods, but we are not used to manage public health crisis in this nature at this scale. COVID-19 highlighted a lot of problems in Malaysia, urbanization and industrialization. Crowded areas, poor living condition of workers will only contribute to the expanding nature or explosive nature of COVID-19 epidemic in the country. Malaysia have always had an issue with border control and transmigration. COVID-19 has highlighted this weakness again and has punished us for our neglect of addressing border control and transmigration. But saying that, what is our strength? In this crisis, we have identified that Malaysia had developed a very agile inter-agency coordination. Just to share with you, when COVID-19 happened, Malaysia had just completed the International Health Regulation external audit. And during that International Health Regulation health audit, we have worked a multi-agency team to address all the audited questions with regard to how to address an outbreak of such nature. Yes, we were beaten by time because by the time we finished the audit, it only took us about 2 months to prepare for COVID-19. But mind you, A lot of effort that we placed during the audit have created a lot of platform for multi-agency teams to work together. The other strength that we notice is the adaptability of the Malaysian Armed Forces and also the Malaysian Police in addressing the need for a very, very new task. How do we help the Ministry of Health in containing the disease? There are many challenges, and the good thing, we have come up with a very good SOP between the Malaysian Armed Forces and also with the Malaysian Police with regard to how to maintain civil-military cooperation in time of need. We have also utilized all available resources in the country. This is the first time where Malaysia uses the military hospital to help and decant government hospital for non-COVID cases. By doing so, the government hospital is able to cater for more cases of COVID-19 in the country. And we have focused our work on dealing with non-COVID so that the work on COVID-19 is so specialized in government hospital. And we took the whole government approach to the next level. Here you can see police and the military roaming the street, ensuring the public of the need to maintain the public health measures, and at the same time assuring the public that hope is available and the government is managing it in the best manner. The other thing that have arisen from COVID-19 is the innovation of the National Task Force, whereby a multi-agency enforcement team led by the Malaysian Armed Forces to look into the problem of transmigration. This innovation have highlighted various challenges in the enforcement process. And there are a lot of studies and outcome that have been arisen from these coordinated activities by the Malaysian Armed Forces. Through COVID-19, we are better able to manage the borders, especially trans-border crime like human trafficking, drug trafficking, smuggling, and we have seen an increase in the level of drugs and also what we call as human traffickers that being apprehended. The Malaysian Armed Forces and Health Service has utilized all its assets to assist in improving or increasing the laboratory support to the Ministry of Health. Another innovation is the construction of function hospital or makeshift hospital to increase the need and of hospitalization for the managing of COVID patients. This requires a lot of adaptability, cooperation, and coordination between all the agencies involved. So far, we have been participating with the Ministry of Health and other agencies to open 3 makeshift hospitals, with the biggest one is ongoing, catering to about 10,000 patients in one area. We have also opened field hospital at prison to ensure that prisoners are able to have care for COVID diseases. Another innovation is how we optimize technology. What's shown here is the MySejahtera check-in registration that allow and assist contact tracing, early warning of areas that have high risk of COVID, and at the same time help individuals to monitor their own health. We hope MySejahtera 2.0 can bring innovation to the next level, whereby individual can assist the health system in identifying COVID cases. So what is the future, the opportunity? At the regional level, we have seen better cooperation among ASEAN members. The ASEAN Center for Military Medicine has acted early in March to address and coordinate activities among ASEAN military member states. Here, through the ASEAN Centers of Military Medicine, we have developed SOPs and also have shared knowledge and creativity to be shared among other members. The other opportunity is basically how do we prepare for the next pandemic? Better crisis response and management is on the way to improve the nation's approach towards such calamity. Malaysia also has seen various advances in medical technology, how we have developed PCR techniques, how can we address better care for COVID patients, and then now we are looking at how we can address on vaccination. So in my conclusion, how does it affect national security? Yes, it affects national security in many ways. It can affect it positively or it can affect it negatively. What we are facing is not important. What's important is what will we be facing in the future, and how Malaysians will thrive beyond COVID is important. We must learn from all crises to reduce risk and to build resilience. And resilience is the ultimate if we want to ensure national security. With that, I thank you.
Thank you very much to Lieutenant General Dato Pahlawan, Dr. Amin Muslan, who is the Director of Health Services of the Malaysia Armed Forces. I would like to remind the audience members once again that we will open up the floor for a Q&A session at the end of this first session. But in the meantime, during the presentations, you may submit and key in your questions through the Q&A box we have here on Zoom. And don't forget to state the name of the speaker that you would like to ask the question to. Next, ladies and gentlemen, we have Colonel Dr. Frank Richter, Head of the Political Department for Strategy Development from the Federal Ministry of Defense in Germany. He has held various positions in the Bundeswehr, the Federal Ministry of Defense, the Supreme Headquarters, Allied Powers Europe or SHAPE, and the NATO Headquarters. He was also deployed to Kosovo as commander of Prison Task Force. Colonel Dr. Frank Richter holds a degree in education from the Bundeswehr University Munich and a doctorate of administrative sciences. We are glad to have you join us all the way from Germany. The floor is yours, Colonel.
Oh, thank you very much. I hope you can hear me, Nadia.
Yes, we can.
Yeah, it works. So good morning from Germany and good afternoon to Kuala Lumpur. And thanks for the introduction, and thanks for the organizing this conference. Maybe you allow me a personal remark in the beginning, because I remember very well my visit to Kuala Lumpur in 2019, when we had a very fruitful exchange with MiDAS and the Ministry of Defense. It was a time when the Malaysian white paper has been drafted, and I have very good memories at that time. It was the first time that I was in contact with MiDAS, so I can say very good to be back again, at least virtually. My short remarks, my introductory remarks will focus on the implications of the pandemic, especially on security and defense, from a German perspective, and in a certain way, it's also a European perspective. And I would like to touch upon lessons learned and actions that have been taken in those two international organizations. And I will focus on NATO and EU because these two organizations are, let's say, vital for German security in general. And at the end, maybe the one or the other information about how the German armed forces are involved in handling this challenge, COVID-19. But I will keep it short because yesterday, Colonel von Uslar has already informed the audience about what the German armed forces are doing during that crisis. So I think there is no doubt, and we can all agree, that the COVID-19 pandemic is certainly the largest and the most disruptive crisis since the end of the Second World War. And it has implications and consequences on nearly all policy fields. And that's the reason why in Germany, the experts are already talking about a polypandemic, because it describes, the word pandemic describes already that this challenge is very multifaceted. And there are a lot of effects. And looking at security and defense, I think there are three main trends that we can observe. The first one is that this pandemic further destabilizes already fragile states, which is really of concern to us, and we have to support those states. So I will talk about multilateral solutions later on. Second, the pandemic might shake strategic power balances and maybe accelerate geopolitical power shifts, especially looking at China and Russia. And finally, this pandemic tests the cohesion within alliances and partnerships. And this is exactly in the same time when we can observe, unfortunately, a kind of relapse into nationalism in more and more countries. So there are indeed some severe risks for defense policy. And at the same time, COVID-19 has shown us very clearly that in a globalized world, all states are more or less connected and intertwined, and that an efficient response to a global public health emergency requires certainly a coordinated international approach. And General Muslan, he already mentioned the word multilateralism, and I would like to underpin that. To tackle such a crisis, we need multilateral solutions. The same is, by the way, true for other future challenges, like the climate change, which is not under discussion at the moment, but I'm quite sure that when this COVID-19 crisis will have been finished, we might come back to the consequences of climate change in some areas of the world. So what's our aim from a German perspective? The main objective is to increase the resilience of states and international organizations and to support the coordination between international organizations. So let's have a very quick look at NATO and EU, as I mentioned already. It's quite clear that the challenges related to COVID-19 can only be solved collectively, and therefore transatlantic cooperation and coordination within NATO has been and will certainly remain one of the key pillars of German security policy. And during the pandemic, NATO, which is traditionally a military alliance with a strong military focus on military capabilities, thanks God, this organization has shown its ability to adapt to new challenges like COVID-19. And let me illustrate that by 4 examples, what NATO has done during the crisis. The first one, NATO has developed an operations plan, which is called Allied Hand, which has been endorsed by the Ministers of Defense in June 2020, this year. And this operation plan comprises more or less activities and measures to respond, to stabilize, and to recover after such a crisis. And the idea is to support all allies and partners, and the plan can be activated if the healthcare system in one of the partner countries is breaking down. So this operation plan is activated until May 2021, and we stand ready to help allies and partners in these circumstances. Germany is more or less providing capabilities in form of medical personnel and engineers. So up to 300 soldiers are more or less on standby to help our partners. Then NATO has, that's the second step, established a NATO Pandemic Response Trust Fund, where we are talking about financial means to quickly acquire and distribute medical equipment. It more or less aims at quick acquisition, reception, storage, and distribution of COVID-19 items. The next one, and that's a very important lesson learned, is that we need within our international organizations contingency plans. And so we are glad that NATO has developed or is developing for the time being a contingency pandemic response plan, which more or less is based on the operations plan Allied Hand. And I think this is one of the main lessons learned. We need plans for such a case, and we need a proper stockpiling to react in such cases. And finally, fourth example within NATO, we have in NATO an organizational element. It's called Euro-Atlantic Disaster Response Coordination Center. Very complicated. Simply to describe it, it's a civil emergency response mechanism which is activated the whole year on a 24/7 basis. And it involves all NATO allies and partner countries and offers assistance mainly in taking care of natural or man-made disasters. It's more or less a coordination element. So NATO has taken some important steps, and from a German perspective, we would certainly support any activity within this alliance which would help to tackle a crisis like COVID-19. With regard to the European Union, in principle, it's the same. The sudden and unexpected emergence of COVID-19 and the way it hit the European continent initially was really a challenge and a test for the cohesion within the European Union and the ability to act. But since then, EU member states and the European Commission have succeeded in developing coordinated and efficient strategies. And let me mention 3 examples in this context. The first one is that we have within the European Union created a task force COVID-19, which is dedicated to temporarily support and facilitate information exchange on national military assistance in support of civilian authorities to help fight this pandemic. And this COVID-19 task force brings together military experts from the EU military staff and external experts as needed. And the aim is simply to share all the relevant information that nations need to tackle this challenge and to share best practices. And examples for activities are, for example, this task force helped to repatriate a number of EU citizens who stranded somewhere abroad, so we brought them back to their home countries. This task force delivered medical equipment, and it carried patients for treatment from one country to another, kind of medevac, you could say. So there are some very practical measures that this task force has taken on a European level across national borders, and that's the very important message. It's something about solidarity, not only coordination in an administrative way. It's a sign of solidarity with our partners and allies. So we have to work together across national borders. And the same is true for a project that we are supporting very heavily within the European Union. It's called European Medical Cooperation 2.0. Well, what we want to do is within Europe, we want a more closer coordination between the various national medical services. And one part of this medical cooperation 2.0 was an exercise that we have conducted in November this year. So that we were able to test the structures and the processes we have. And this exercise will now be the basis for shaping our future processes and structures. Yeah, and finally, with regard to the armed forces, and now I come back from the international level, NATO and EU, back to the national level, what the German armed forces are doing during this COVID-19 pandemic. We have more or less more than 10,000 soldiers now here in Germany you could say, in an internal national mission. So we are supporting regional government health agencies, we are supporting hospitals, test stations, nursing homes. So we are providing administrative assistance, but not only nationally. During the last month, we had more than 70 requests for international assistance from more or less 40 countries or international organizations. For example, the Institute of Microbiology of the Bundeswehr delivered more than 75,000 COVID-19 test kits, especially to our partners in the Sahel region. And that brings me back to what I said in the beginning, multilateral solutions across national borders, and you could say across continents, because from a German and European perspective, Africa is our neighbor. So we are heavily supporting our partners in Africa as well, and that's a good example for that. And looking in the future, as soon as we will have a vaccine, which will have been approved, the Bundeswehr will contribute through logistical support, storage, and transport, as well as in the future we will support the vaccination centers as well. So there is a bunch of activities and lessons learned. There is still a lot to do, but I think we are on a good way to be better prepared for the next pandemic. To sum it up and maybe come up with some magic words or catchwords, what was my main message? The first one was we have to strengthen our resilience nationally and within the international organizations. We need international cooperation and multilateral solutions. We need solidarity. And at the end of the day, we need even more coordination, even between international organizations. And we need international organizations. So that concludes my short remarks, more or less short. I hope I was not too long. Thank you very much for your attention. Back to you, Nadia.
Thank you. Thank you, Colonel Dr. Frank Richter, Head of the Political Department for Strategy Development from the Federal Ministry of Defense, Germany. I think a key takeaway from your presentation, Colonel, was that solidarity is very important and is key in fighting this pandemic. Ladies and gentlemen, our third speaker is Mr. Thomas Koruth Samuel, who is the Regional Consultant for Terrorism Prevention with the United Nations Office on Drug and Crime. He is currently pursuing his PhD and studying the role of the quest for personal significance in motivating terrorism among Malaysian youths. His areas of research include preventing and countering violent extremism, law enforcement, and civil society organizations, and the radicalization process. At the international level, he was appointed in 2014 as a senior fellow with the International Center of Excellence for Countering Violent Extremism in Abu Dhabi. In 2018, he was appointed for a 2-year term as a member of the Commonwealth Countering Violent Extremism CVE cadre of experts. The floor is now yours, Mr. Thomas.
Thank you, Nadia. Are you able to hear me?
Yes, we can hear you.
Okay. Firstly, I thank God for this opportunity. I'd like to thank MiDAS, the organizers in MiDAS as well as in KAS for giving me this opportunity to share a little bit about what I perceive to be the intersection between terrorism and COVID-19. Let me first start with the good news. I remember when I was a small child, every time I did something very bad, I would go to my mother found out and confronted me about it. I would tell her, look, there's the good news and there's the bad news. And I found out by saying that I could get away with things. And I noticed even now that I'm married, I keep telling my wife there's good news and bad news. So let me start with the good news first. We find that because of this situation, there's a reduced recruitment initiatives on all offline platforms and public spaces. This basically means that because violent extremists need public spaces to attract and indoctrinate and recruit new followers, and because of the COVID situation, we find that there are restrictions on these public places, movements and travel. So we find that there's lesser opportunities for violent extremists or terrorists to radicalize and recruit via public spaces. So that's a positive thing that we have found. Number two, there's a decreased media exposure and visibility for violent extremist groups. I'm sure you all know, for a violent extremist group, I remember we had a leader in one of the terrorist organizations in this region. He said this, when somebody asked him, what is terrorism according to you? He said this, kill one, frighten 10,000. So in the eyes of violent extremist, media is extremely important, and they depend on the media coverage to spread fear and gain visibility. In that case, we have found that COVID has knocked off violent extremist groups from their media pedestal. So there's less reporting when it comes to terrorist organizations now because of COVID. Number three, there is a possibility of discontent towards leaders of violent extremist groups. Now, we find that terrorist organizations, their leaders, they're extremely charismatic, sometimes even cult-like in their approach. Now, if their leaders are not able to take advantage of the pandemic or even lose out from the pandemic, followers might lose faith in their leadership and possibly turn against the group. So if the followers get infected by COVID, for example, or the people themselves, the population, have more urgent needs besides supporting the violent extremist organization, that could lead towards a possible discontent towards the leaders. So these are basically the only possible good things that have happened thus far. Now, I would like to put out this reminder here. When we talk about violent extremist organizations, we should not confine just to the usual suspects. It's important to note the right-wing extremists. These are white supremacists who have linked the virus to immigrants and non-whites. This has happened. They use the crisis to promote many times nationalism, ethno-nationalism. For example, you have the Nordic Resistance and the 100-Handers. These are examples of organizations, in this case, right-wing extremists, who have used COVID-19. You have left-wing extremists. They focus on the impact of the pandemic on the economy and the environment. So they have called out for utilizing violence. They have called out for attention to their cause by utilizing violence. So what has been the response of the terrorist organizations to this pandemic? Number one, they have said that this is divine retribution on non-believers. This is basically punishment from God. They have specified certain instances. For example, they've said this is against China. This is punishment from God on China because of their treatment of the Uyghurs. They've said that it's revenge for the destruction of Syria during ISIS's last stand in March 2019. That because of that, this is how God is punishing. And of course, they've blamed the West. And this is in most terrorist organizations, that's constantly there. They're blaming the West. So Al-Shabaab, they've blamed the spread of the virus on the Crusader forces who have invaded the country, as well as the disbelieving countries that support them, basically the Western allies. Al-Qaeda has condemned the immorality that has caused this virus. So blaming the West has always been a usual punching bag. Some terrorist organizations have advocated to weaponize the virus. For example, you have far-right extremist groups discussing online on how to purposely infect members of minority group. It is an opportunity to conduct an attack on government as they are in the state of weakness to deal with the pandemic. Let me just quote a terrorist in Indonesia. He said this, if COVID-19 could speak, maybe it would say, we've got the Vatican surrounded. What more are you waiting for? So why are we keeping quiet? Corona has opened the way for us, shoulder to shoulder, let's attack them. Ali Kalora, who is the leader of Mujahidin Indonesia Timur, MIT, he said this, truly victory is near. The oppressor will fall because of coronavirus and this war. God willing, it will happen soon. So these are cases of organizations which have attempted or at least advocate weaponizing the virus. ISIS, for example, they've advocated utilizing their supporters who already have the virus to try and transmit it to those who are considered the enemies, such as the police. In saying all this, you have the pragmatic terrorist. If you look at this list, it looks like what a country, the medical authorities of a country will say. Don't travel to afflicted areas. If you're in an afflicted area, don't leave. And last, wash hands. Cover the mouth when yawning or sneezing. This is a public service announcement by Daesh. So what is the short-term impact for the violent extremist? Number one, this is an opportunity for them to fill a gap or a vacuum in governance. Now they are taking advantage of the authorities whose resources are stretched very, very thin. Violent extremists are reinventing themselves as service providers, providing service either in providing food or basic healthcare to at-risk population. This is what they're advocating. This is what they're advertising. Because the reality is the authorities in many countries have to deal with two problems. Number one, the pandemic, and number two, violent extremists. A military commander in the Philippines, he said this, I quote, we are battling against two different enemies, end quote. So what should we do in such situations? It's important that the authorities support and strengthen the capacity of local actors. For example, civil society organizations to provide assistance to the people. Because if the government cannot provide and they do not equip CSOs to provide, that vacuum or that gap will be filled by violent extremists. Number two, they're taking opportunity to take advantage of the chaos. So you have the political, economic, and social disruption seen in many parts of the world, for example, in West Africa. So Daesh has said this, I quote, this is an opportunity to attack the West while they are weak and distracted. Again, I would like to quote Ali Kalora, the head of the Mujahideen Indonesia Timor. He said this, the taguts or the tyrants will fall because of the coronavirus and the war in the near future. Daesh has mentioned this, capitalize on the paralysis and fear overtaking the Crusader countries amidst the pandemic. They've also said, I quote, show no mercy and launch attacks during this time of crisis. So take advantage of this chaos. Violent extremists are also advocating and saying that this is an opportunity to introduce, validate, and reinforce a particular worldview. This is the best time. So for example, right-wing groups, they are advocating for stricter border control. They are basing many of the allegations that the foreigners are the cause of this disease. They are suggesting that we halt migration of foreigners into our lands. Left-wing groups, they are saying, look, this is a great divide between the haves and the have-nots, the corruption of the big government. And they are advocating that, look, they're advocating this specific world point of view. And of course, as mentioned, the religious extremists, they are saying the irreconcilable divide between us and them, the decadence of the West. So this is an opportunity for them to present a worldview, and they will have a receptive audience due to the pandemic. This is also an opportunity for them to plan and accelerate attacks. So they've evolved in their methods and their targeting. They're looking at opportunistic attacks. For example, Daesh has mentioned about launching attacks on weakened infrastructure or soft targets. They're speaking about hospitals and supermarkets because they're saying countries are distracted by the pandemic, attack these places. March 2020, Timothy Wilson was planning to bomb a Missouri hospital treating COVID-19 patients. He planned the attack for months, but decided to accelerate his plan to target the hospital because of the pandemic. So in this situation, the authorities need to prepare for modified attacks by taking target hardening measures. So for example, hardening targets of hospitals and of supermarkets, for example. Violent extremists are saying that this is the opportunity to spread disinformation, conspiracy theories, and propaganda. And you see this happening. So for example, right-wing violent extremists, they have started spreading xenophobic or anti-Semitic narratives. A terrorist once told me this when I interviewed him. What you need to do is you need to focus on emotions, because emotions allow you to go to the heart by bypassing the mind. So this pandemic has resulted in financial hardship, has resulted in isolation. And people are very evocative at this moment. And this is what terrorists or violent extremists could take advantage of. They are undermining trust in government or moderate political groups when they spread these conspiracy theories and propaganda. So in this regard, it's important for the authorities to build strategies for effective, innovative, either alternative or counter messaging. So we also need to focus on improving the capacity of key actors to counter violent extremist messaging. Now, the key actors would differ from place to place. It could be religious leaders, it could be youth leaders, it could be teachers, it could be parents. Violent extremists speak about the opportunity to reach and radicalize a captive audience. There is an increased opportunity online. I mentioned earlier about the good news of a decreased opportunity offline, but the reality is in social media, the opportunities are tremendous. So right now, because of the pandemic, people have nothing to do. And you include the fact that they have access to social media. Now you have a perfect storm of potentially radicalizing a huge number of people. Now, this is particularly true for young people who are susceptible because they're spending increased time online. In many countries, schools, colleges, and universities have now ceased to function, or their students are actually studying from home. This means that they're actually not going to these physical schools. They're spending their time online, and this could heighten the chance of them being recruited online. So with regards to this, what can the authorities do? The need to develop and implement online resilience building initiatives and campaigns. We need to reach out, especially those who are vulnerable, and build their resilience. We also need to target and build capacity of others who could help us out. Like who? Like social influencers, YouTubers, youth leaders, religious leaders, to counter online radicalization and recruitment. So these are short-term effects which violent extremists are able to inflict because of the pandemic. What are the mid to long-term impact of these violent extremists? Firstly, the opportunity that comes from reduced national or international focus and funding on violent extremists in response to the pandemic. The reality is this, that nations, either at the national level or international level, have limited resources. And because of this pandemic, they need to cater, especially at the health sector. So this could possibly mean reduced funding or reduced focus on traditional PCV programs. And that's something that we need to consider very carefully. So for example, Daesh has said this. They've openly declared that the international community will be hesitant to send troops abroad, and hence have urged their followers to take advantage by intensifying their attacks and escalating both the quantity and the quality of their attacks. So this is something that we need to take into cognizance. The national authorities might stop or reduce or reprioritize funding for PCV initiatives. So there'll be increased funding for health issues at the possibility of the expense of PCVE, or Preventing Countering Violent Extremism initiatives. EWER, or Early Warning, Early Response Mechanisms for Preventing and Countering Violent Extremism, could be crippled. So for example, there are extensive early warning, early response mechanisms in institutions of higher learning, in institutions of education. But right now, as I mentioned earlier, these institutions of education are not actually functioning. The students are learning from home. So previously, they used to have programs in which they could identify students who showed signs of radicalization. But because of this non-contact at this point, non-physical contact, this will stop. And you have many PCVE engagements at the community level. Those will stop. So here, we need to realize that it's still important for authorities to prioritize PCVE initiatives. Violent extremists will take opportunity to take advantage of the tensions created. This was mentioned by my fellow panelists earlier on. At the national level, there could be perceived inequality due to the distribution of resources, support, and care between groups, intra-religious or intra-race. At the national level, there could be perceived inequality in the distribution of vaccines. And this could happen at the international level. So hence, Global Justice Now, which is an NGO, they have said this: 78% of the Moderna vaccines sold to rich nations, with only 12% of the world's population. Now, by no means is Global Justice Now a violent extremist organization. They're just an advocacy group. But things like this could be picked up. by violent extremists into saying that, look, there is obviously a perceived divide, there is injustice which is happening, even when it comes to the distribution of vaccines. The violent extremists speak about the opportunity to take advantage of the deepening inequalities. Now, violent extremists will take advantage of the social, economic, and political inequalities which might arise from this pandemic. There's a backlash against globalization. That's a backlash against perceived hypocrisy. So in these situations, there's the idea of forming the common enemy. It could be the West, it could be the elites within a country, it could be a certain race or religion within a particular society. So what are the points to ponder? Number one, we need to take into cognizance the ways of violent extremist financing. Now, they will emphasize that they are collecting funds for humanitarian relief organizations. And many people will be donating to these causes, thinking that the money is going to go to help people who are suffering due to the pandemic. We need to be careful about this. So how do we prevent this? We need to build the capacity of the authorities to prevent violent extremists from raising or moving funds. And there are many ways to do this. For example, Security Council Resolution 2462 in 2019. We need to be careful that these people will be raising money and will be using the pandemic as an excuse. The importance of horizon scanning, and this is tough. Anticipating possible future threats and disruptions. Now, COVID-19 to a certain extent shows that we are not very good in horizon scanning, and we need to improve, to think and to ponder the improbable. I mentioned this earlier, but we need to focus on the equity in vaccination, because that is a possible flashpoint which could be used by violent extremists. Any perceived unfairness in the distribution and the delivery of the vaccine could be a sore point and subsequently a radicalizing factor. We need to address the asymmetry of passion. Oftentimes, when I see how active violent extremists are online and I compare to what authorities are doing, there is a deficit. When it comes to passion, we need to find people who are passionate on our side, on the side of the authorities, to be able to go out there, reach out to people who are in need and present our point of view. There is a need for wisdom. Many a times, efforts seemingly to help the situation have made the situation worse. There is a need to know what is happening on the ground. There is a need to conduct research to make sure that our efforts in actually solving a particular problem does not make the situation worse. Lastly, there is a need for humility, and I cannot stress this enough. No one nation, no one organization, no one, whether it's a multilateral or a bilateral organization, can solve this problem. We have to learn from each other. This pandemic has shown that there is very little choice in any other way. So with that, I would like to thank you and just leave you these points to consider. Thank you very much.
Thank you very much, Mr. Thomas Koruth Samuel, the Regional Consultant for Terrorism Prevention with the United Nations Office on Drug and Crime. Now, we will open up the floor for a Q&A session, but before that, we do have a poll where we will display a question for all of you. Here it is. Do the security measures taken in your country during the pandemic make you feel more secure? We would like to know your thoughts on that, whether it's a yes or a no. You can submit your feedback right now and we'll take a look at the results. So again, ladies and gentlemen, we have a poll here, a very quick one. We'd like to know whether the security measures that have taken place in your country have made you feel more secure. And these are the security measures taken in light of the COVID-19 pandemic, making sure that everyone can stay safe. I'm not sure whether we are able to see the results, but we were able to yesterday. All right. Okay, here the results are. 91% of you have said yes, while 9% said no. So I think that's quite comforting to know that most of you do feel safe and secure with the security measures that have been taking place in your respective countries. And of course, there's room for improvements to be done as this pandemic is unprecedented. Now, ladies and gentlemen, I want to open up the floor for a Q&A session. I see that we already have some questions that have come in. The first one, Mr. Thomas, goes to you. This is from Hamzah Isha of NSC Malaysia. He asks, does the spread of COVID-19 affect terrorist activities due to movement control, especially in the Europe and Southeast Asia regions? Mr. Thomas.
Yeah, thank you for the question, Tuan Hamzah. Yes and no. So the offline spaces, that means the ability to hold gatherings have decreased. So at the offline spaces, as I was speaking earlier, that has reduced. But online spaces, we see an increase. In terms of attacks, in Indonesia, there is MIT, Mujahidin Indonesia Timur, has conducted attacks even during the pandemic. But generally, there is reduced attacks. However, as how we are waiting for the pandemic to end, we can actually assume that the terrorists themselves, the violent extremists, are eagerly waiting to get back to business.
And so another question here from Azizi Ahmad Sarkawi. This is for Colonel Dr. Frank. He says that you mentioned about geopolitical effects. In your opinion, how can this effect be best dealt with among the affected countries, especially in utilizing military arsenals? Colonel Dr. Frank.
Yeah, thank you very much for this question. I will try to keep it short and to the point. From a German perspective, when we are talking about geopolitical shifts or geopolitical balance, we should not look at the military capabilities at the first instance, because the balance between the big powers, and you can name them, USA, China, Russia, should not be at the end of the day a simple military problem. But what we should do is that those countries who share the same values, and there are a lot in many regions of the world, they should work more closely together. They should come together and have a common opinion in a certain way. And that's the reason why we in Germany, we will try it within the next weeks and months to work very close together with the United States. And we are looking for new partnerships even in the Indo-Pacific area. You might know that the German government has published a few weeks ago new guidelines on the Indo-Pacific, and that's exactly the message that we have. We are looking for partners in all regions of the world who share our values, and I think this cooperation, the cooperation between those who have the same view on the world, that might be the best way to find an own role within this geopolitical business, you can say. That's more or less the answer. It's not only military capability. I would look at all policy fields, and the military is only one part of it. And maybe in this case, not the most important one.
Colonel, there's another question. This one is from Chen Chen Eng. Is there hope that the new multilateral task forces that were created will be strengthened and kept up even after the end of the pandemic to ensure continuous exchange? Colonel, you're on mute.
Yeah, thank you very much for this question. Indeed, I am optimistic that it might be part of the lessons learned process that we are running through at the moment, that we need more organizational elements on a, let's say, multinational level. And so indeed, I hope that this will happen, that there is a continuation of this, you could call it task force or whatever it might be, but we need standing structures to improve our coordination, even in the field of the military. And we as the Germans, we are very interested in strengthening those organizations and structures. So I'm carefully optimistic, let's say. Thank you.
Good to hear. I want to go back to Mr. Thomas. Are there regions in Southeast Asia where you see a particularly big risk of increased terrorist recruitment?
Thank you for the question, and Nadia, as well as for the audience, member of the audience. I don't think there's a big risk, but I do think there are risks. And the situation is still playing out before us. So it's still a little bit opaque and on how it's going to actually turn out. But there are still risks because fundamental issues have still not been resolved. And until we address these root causes, whether it's within the region or beyond, there will still be issues. So both at the local level as well as international issues, they both play a role in actually contributing to the radicalization and recruiting of violent extremists.
Okay, before I conclude or wrap up this Q&A session, just one more question for Lieutenant General. Lieutenant, you mentioned in your presentation that drug offenses have spiked during the pandemic. So do you think that the pandemic has actually given leeway, making it easier for criminal activities to take place? Or is it the opposite actually?
Thank you, Nadia, for that question and also clarification. I believe what I intend to say basically, because of the lockdown and also because of the increased border monitoring and surveillance, we have seen a reduction in drug trafficking. Actually, you see, the numbers of cases that of drug traffickers that have been caught at the borders is much higher now. We are seeing cases like in terms of millions of ringgit worth of drugs that been apprehended. So increased security forces in the border has helped to reduce this thing. Whether it is something that has been happening and now that we are discovering, it can be so, and we have to just continue and persevere doing it, and hopefully it will reduce.
All right, with that, thank you to our speakers. Thank you to Lieutenant General, Colonel, and Mr. Thomas for the first session. It was an insightful look on the effects of the pandemic towards national security. We have now come to the second session where we will now indulge on the impact of the pandemic beyond just our health. The impact of the pandemic may be bigger than what we think. So let's find out other underlying issues that may stem from a pandemic. Our first speaker is Mr. Thomas Benjamin. He is the Senior Analyst in the Foreign Policy and Security Studies Program of ISIS Malaysia. His interests lie in the security strategic challenges and impacts of major power dynamics on ASEAN and its member states, the South China Sea dispute, and Malaysia's national security and foreign policies. He also looks at the policy implications of refugees, asylum seekers, and other displaced persons in Malaysia, and the Malaysian government's refugee policy of not having a policy. Previously, he was a public relations practitioner focusing on social media management and media engagement strategies for clients from governmental and enterprise technology sectors. With that, I will now pass the floor to you, Mr. Thomas.
Thank you, Nadia. Can you hear me clearly?
Yes.
Fantastic. Well, first of all, thank you for having me. I realize that in the program it probably states that Mr. Harizal will be speaking. I am clearly not Mr. Harizal, and I'm sitting in for him today. So since the previous session has focused on the security paradigm, what I would really like to do is to step back and to look at COVID-19 from a broader international relations and a geostrategic political perspective. So there are 4 points I would like to make. And Nadia, please, if I'm exceeding time, please let me know, okay?
Sure, will do.
So the first point is that COVID-19 didn't just impact major power geostrategic rivalry, but it became subsumed within it. So, COVID-19 really disrupted the international order and rules-based system that was already under a lot of stress and was increasingly rudderless. And one of the best symptoms of this was how the pandemic impacted the increasingly competitive and very fractious US and China dynamic, which was already not in good shape before the pandemic struck and had deteriorated to one that was almost adversarial in nature. Disputes over trade, communication technology, data security, international rules and norms, and intellectual property have only worsened during the pandemic. So these two global powers hold a lot of sway over the global architecture, and they have both fallen short of the responsibilities that come with their position. Instead of setting aside the disputes and cooperating in the face of a pandemic that recognizes no borders or nationalities, both of these global powers have continued to engage in wars of narratives on the spread and the management of the pandemic. And this adversity has actually begun to impact. Sorry, just 1 minute. Sorry, there we go. Yeah, so this adversity has really spilled into how their diplomacy with other stakeholders. For example, under the Trump administration, the outgoing Trump administration, DC doubled down on accusations that China had deliberately played down the extent of the pandemic, and it went around urging countries around the world, especially in Asia and in Southeast Asia, to join this narrative and to compound pressure on China. The WHO, for all its faults, and there are faults, found itself dragged into the spat, going as far as to lose funding from the US, its biggest donor. Although the Biden administration, from what I've been hearing, the Biden administration has indicated that it will re-engage. Beijing, on the other hand, has used its capacity to deliver aid, has used its economic clout that many countries will need to get out of this recession to not so subtly elicit positive comments about its success in managing the pandemic. In Europe, for example, China's diplomats have been accused of overtly trying to influence inquiries into the origin of the novel coronavirus and how the EU has managed its response. You get reports of this from Latin and South America as well. And closer to home, China has continued and in fact intensified its activities and maritime harassment in the South China Sea, particularly at a time where it knew that other stakeholders were under increasing pressures because of the pandemic. So this state of affairs has really complicated matters for the rest of us who prioritize regional peace, multilateral cooperation, and adherence to international norms. And on top of that, the strategic competition for influence and favor between these major powers will continue through upcoming pandemic healthcare and vaccine diplomacy. And this leads me to my second point, and something that Thomas Samuel touched on earlier, which, the rollout of COVID-19 vaccines, I think will only highlight further the challenges on global inequality that has already been laid bare by this pandemic. So the UK became the first major Western country to approve a COVID-19 vaccine, and it looks like we are on the beginning stages of mass immunization of high-risk individuals as early as this month. However, as we are on the standpoint of entering a new phase against the fight, a new phase in the fight against COVID-19, one where there will be a mix of preventive, treatment-based, and immunization measures. So in real world terms, I think we're looking at of having to deal with this virus, having to deal with the infections, yet while we slowly inoculate a global population. So this virus and this is going to be with us for still some time. And this phase will be particularly fraught. Though there is now some prospect and hope of a growing array of vaccines, sufficient doses will take considerable time to produce, distribute, store, and administer. And this is where, as Thomas Samuel said earlier, this is where global inequalities will really be clear for all to see. Some countries will be able to vaccine their populations more quickly than others. And, and those who are the first ones to do so will be able to create travel bubbles among themselves. In the meanwhile, many less developed countries will struggle to secure sufficient doses of vaccines. Others will have difficulty in reaching out to rural populations or lack the capacity to fight anti-vaccination rumors. The sort of rumors that have already led in some Muslim majority countries to an increase in vaccine preventable diseases like polio and measles. So the gaps between the haves and the have-nots of the world, which is always there, which has been laid bare by COVID-19, will now take on a new dimension as the vaccine comes, as the vaccine rollout continues. And I don't mean to sound alarmist. Things may well be resolved quickly if the world were to somehow get its act together, but we should not be blinded to the very real possibilities that there are vast inequalities And these inequalities will deepen over the next 2 or 3 years with major consequences on political, social, economic, and international relations fronts. We might have a 3 to 4 tier world over the next 2 years, and that's going to be a problem, because it will open opportunities for richer nations to influence these nations that desperately need help, and it is precisely then when these grievances will peak and established systems, norms, rules of law, and authorities will be challenged. So, from that bit of doom and gloom, let me move on to something a little bit more positive, and which is my third point, and that is that multilateralism, might have taken a beating, it might be battered, but it is not out for the count. So we are more or less a year on from when COVID-19 was officially detected in Wuhan, and another 3 odd months away from when global travel restrictions kicked in, which was in more or less in March and April this year. So aside from the competition between major powers, which I mentioned earlier, even regional organizations had a hard time in coming up with a coherent, unified response in the early to mid stage. And the EU and ASEAN really come in mind here. So the virus has exacerbated cracks in existing international multilateral systems that underpins much of our global and regional architectures and mechanisms, and multilateralism seemed to take a back seat. Instead of international cooperation for cohesive, integrated responses, we got impositions of unilateral travel bans without consultation, denials on the severity of the situation against mounting evidence to the contrary, an initial lack of clear strategy and communication plans, inevitable social panic, and dog whistling to deflect blame. Thankfully, this seems to have abated somewhat. Coordination seems to be back on the cards. Perhaps as policymakers are now more used to the idea of living with this virus for the next couple of years, and that might have sort of stopped knee-jerk reactions for now. A key development to point out here is that the incoming Biden administration's commitment to multilateral engagement in engaging on the distribution of vaccine and in global healthcare policies that will be coming up. So in our part of the world, I think a big part of this improvement is because of the efforts put in by policymakers, technocrats, and other civil servants in ensuring that various scheduled regional multilateral summits and mechanisms continued, although they continued online and in a significantly reduced scale. So I'm thinking here particularly of the 36 and 37 ASEAN summits and its many associated meetings, namely the East Asia Summit. I'm also thinking of APEC. So all of them continued and all saw substantive discussions and tangible agreements on plans of actions, declarations to address this ongoing impact of the global pandemic and its ripple effects. Look, I'll be the first to admit that I am very critical of ASEAN, and I was very critical of ASEAN in the early months of the pandemic. But it has certainly gotten its act together. Recent outcomes have stressed the importance of solidarity and cooperation, with cohesion not just limited to member states, but inclusive of external stakeholders, which is very important. And it's also nice to see the Malaysia proposed ASEAN Comprehensive Recovery Framework, which this government first proposed in April and then worked with other ASEAN member states, adopted last month. So there is a very clear roadmap, a very comprehensive roadmap in line to recovery as best we can. And now, given the 3 points, let me conclude with my fourth point and my last point, and I will try and make this quick. The fourth point is that, with all that in mind, there is a real need and opportunity for responsible middle power engagement, not just in Asia Pacific, but globally. So this pandemic has really emphasized how essential major powers, the need for proactive major power engagement to ensure regional peace, multilateral cooperation, and adherence to international norms, especially given, in my view, how irresponsible major global powers have been. And many of these middle powers, Australia, Japan, South Korea, perhaps even India and Indonesia, and there's a lot of contention over what a middle power means. Some people think that they should be great powers, while some people think they should be middle powers. Are at different stages of managing the pandemic, which will take up much of their attention and resources. Nevertheless, I think these middle powers have an important stake in the international system and in the rules and norms that govern it. Ignoring the latter, while major powers continue to shape it along the lines of great power politics and major power politics, will be to everyone's detriment. And while the aforementioned countries, some of the aforementioned countries might have more in common with the United States, it is important to note that the behavior of both the United States and China are a real cause for concern to many different countries for different reasons. And the divergent interests of both are leaving the Asia Pacific at a disadvantage. So middle powers therefore need to figure out not only how to work with each other, but also with smaller countries and regional organizations like ASEAN to chart a middle and more inclusive path. With that, Nadia, I am done with my comments. Thank you.
Thank you very much, Mr. Thomas. Thomas Benjamin, Senior Analyst in the Foreign Policy and Security Studies Program of ISIS Malaysia. Before we move on, I'd like to remind our audience members that we will be opening up the floor for another Q&A session. So in the meantime, you can already submit your questions in the Q&A box, and don't forget to state the name of the speaker that you would like to ask the question to. So thank you again to Mr. Thomas. Our next speaker is Professor Dr. Terence Gomez from the Faculty of Economic and Administration of University Malaya. He specializes in political economy, where he looks at state-market relations and the linkages between politics, public policies, and capital development. He has served as project manager and research coordinator for a program called Identities, Conflict and Cohesion at the United Nations Institute for Social Development in Geneva, Switzerland. He also serves on the editorial board and advisory committee of various international journals, including Journal of Development and Society, East Asia, in International Quarterly, and Journal of Asia, Entrepreneurship and Sustainability. He is also an editor of the Chinese Worlds and Malaysian Studies series for Routledge, London, and New York. With that, take it away, Prof.
Thank you, Nadia. Can you hear me?
Yes, we
Nadia? Okay. First, since I have only 15 minutes.
Presentation in presentation mode. Can you switch to presentation mode?
Is it okay now?
Yes.
Yes.
Thank you.
I have only 15 minutes, so let me get straight into this. Before the crisis began, the world was already debating two particular types of models for development. One was what was called the business-led development model, or the neoliberal model, best epitomized by the United States. And the other one was the state-led or government-led model, the interventionist model. And this was best seen in the case of China. And it's interesting that the top two economies in the world today are, of course, the United States and China. When the crisis occurred, a phenomenal event simultaneously happened in the economy. The economy went into a close down. And what that meant was, since private firms were now in lockdown, who could then intervene to take the economy forward? And state-owned enterprises then became a major player. The government had no choice. They had to intervene. When they intervene, how do they intervene? They use the state-owned enterprises. Now, what is interesting is that for all the talk about the rise of China and its use of its state-owned enterprises to go global, there's been very little research about state-owned enterprises. Until now, when the COVID crisis occurred, people are beginning to realize this is an important enterprise that we have to pay attention to. But having said that, look at the figures that I have here before you. You will see here now, for example, state-owned enterprises have been growing by leaps and bounds over the past 10 years, past 20 years. And of course, the country that is most significant in terms of use of its state-owned enterprises is China. But if you look at the other figure, figure 2, what is also interesting is that you will see that every country in the world, well, nearly every country in the world, they have state-owned enterprises. And among the countries with the most state-owned enterprises, many of them appear to be from Asia, Southeast Asia, and East Asia in particular. What is also interesting is this: how did these countries respond to the crisis? Which were the countries that responded well? I would like to argue that the countries that responded well and fastest were those countries that also had where the government had significant control over state-owned enterprises. The case of China, Singapore, Vietnam, and one can argue also Malaysia. I don't have much time, so I'll go straight into Malaysia. I want to show you the state-owned enterprise world, or what we refer to them here as GLCs, government-linked companies. So the Malaysians sitting here in this crowd today will be very familiar when I say GLCs. It's a very well-known term, especially of late, because it's also become a very important topic of discussion in the political arena. But here what I'm showing you is what the government calls government-linked investment companies, and they are, for example, the Minister of Finance Incorporated, that's the holding company for the Ministry of Finance. We have the Sovereign Wealth Fund, Khazanah National. We have the Equity Investment Fund, the EPF is the Employees Provident Fund. We have the Pension Fund, KWOP for pensioners. We have Tabung Haji, which is the pilgrimage funds for Muslims. And we have the Tabung Angkatan Tentera Fund, that is the Armed Forces Pension Fund. Just these seven companies own a huge multitude of publicly listed firms. And here is an example of just these seven in red. And look at the publicly listed companies that they control. And as you can see, I'll just focus on, since a lot of people from the Ministry of Defense are here too, I'll focus on LTAT right there at the bottom left corner. LTAT, for example, controls Borsted, and Borsted is interesting because this company owns a pharmaceutical company, Pharmaniaga. Affin Holdings owns a bank, Affin Bank. But let me put this now here to show you the significance of how big this GLC world is just in Malaysia. But mind you, it's also big in other countries like China, Singapore, and so on. I'm showing you here now, this is the list of the business groups in Malaysia, which are, these are the top 50. The ones in red are those which are GLCs. And what is significant is if you look at the top 10, 8 of them are GLCs. But also look at what sectors they are in. They are involved in banking, they're involved in utilities, petrochemicals, plantations, Sandabi, healthcare, telecommunications. Now, all this is very important because when the crisis occurred, for the Malaysians in particular, they will remember the government came up with a stimulus package and the government turned to these companies. The finance minister himself talked about a government ecosystem. He said, I'm going to use the government ecosystem to help the economy. I am showing you here now that government ecosystem. And how did it work? The banks, for example, he asked the banks, the GLC banks in particular, put a moratorium on loans. It still prevails. For the utilities companies like Tenaga for power supply, he said, cut down the rates for power supply. Don't charge them so much, which they did. And for telecommunications, Axiata, for example, Telecom Malaysia, he said, let's reduce the rates for telecommunications too, because people are going to work from homes. There's going to be e-learning, and the rates for telecommunications also came down. So what this showed was the government very quickly, because they controlled the largest enterprises, which were significant players in the economy, could deal immediately to help sustain the economy in a time of crisis. This is the good of the government ecosystem. This is the good of the GLCs. But let me take you further. This is not just that world. I want to show you another world. This is the world of the ministries. The government has about 23 cabinet ministries, 20-odd cabinet ministries. They are...
Prof, sorry, could you move closer to your microphone? We are losing your audio at certain times.
Can you hear me now?
Okay, better.
Can you hear me now?
Yeah.
Okay. Now what I'm showing you is the ministries in the cabinet. And what is significant here is that these ministries also own companies. Now, if the earlier diagram that I showed you was only focusing on publicly listed companies, these ministries control unlisted companies. And now how big are they? Here, I'm showing you a snapshot of the ministries, just 4: Ministry of Finance, the Prime Minister's Department, PMD, the Ministry of Rural Development, MRRD, and the Ministry of Science and Technology. This is very important. All 4 ministries are very important. They're all very important because you need the Ministry of Finance to provide the financing. You need the Prime Minister's Department to provide the direction. You have to focus on rural development. It's focusing on agriculture and science and technology. This is a period when we need science and technology urgently. And what you can see here in the legend, I can show you is, what I'm showing you here is we have the GLICs, the first diagram I showed you, government investment companies. We have statutory bodies, we have holding companies. We have in purple the GLCs. The government controls a huge segment of the corporate sector through the GLCs. Now, what did they do with this? Here, this is very important because I'm showing you when the government intervenes and when they control GLCs, what can they do? So Ministry of Finance, they're involved in economic matters, they're involved in social matters, pension funds, for example, EPF, KWAP. KWAP, as I mentioned, is the pension fund for public servants, public sector members, regional development, regulatory bodies like the central bank and the stock market, and investment funds like the Sovereign Wealth Fund, Khazanah. For the Rural and Regional Development Ministry, they control land development, regional development, land redistribution, all important issues. When we discuss inequalities, when we talk about wealth distribution, land matters, when we talk about urban, rural disparities, here they are. They also have a big focus on education, another important area. And for science and technology, the ministry, very important ministry, especially today, they finance major industries. They are extremely important for research and development, for technological development. You have to turn to the government because investments in technology is very expensive and the government has to fund it, especially at a time like this. So what I'm showing you in this diagram is basically how the government can intervene, not just in the economy, but also in terms of social issues. And at a time of crisis, when we can't expect companies to do much, the significance of what the government can do through an institutional framework such as this, as the one I'm showing you here now, can be important. And this is what the crisis taught us. This is a major institutional framework which can do enormous good, especially at a time of crisis, not just for the economy, but also in terms of social matters. So my conclusion in the things of what have we learned. So let's start with the government ecosystem. This GLC framework, which the Minister of Finance has referred to, is something we have had since 1970. It has grown by leaps and bounds. In fact, it's grown so big that even the Malaysian government bureaucrats will admit they have very little clue as to how big it really is. It has become a key component of the political system. But what we have seen here is that it can also be used as a social tool to intervene. They're not interested in profits now. They are only interested in how can we intervene to save lives, for the well-being of people. For that, we turn to the executive. What can the executive do? The Prime Minister, for example, do with this world? And you have seen here now economic decision-making. We have seen him doing this. Policy direction. He can change policy directions quickly, intervene immediately. And you heard some of the references here by the previous speakers on this matter. Create new forms of incentives for companies when they are back on track to invest. They can create incentives to save them, to provide them with wage subsidies, for example, to take care of their labor. This process, if it's can be extremely developmental, provided it is transparent. But if it is not transparent, if it's used for rent seeking, then it can become predatory. And then we will see huge wastage. It can go either way. The problem with Malaysia is we have a case of GLC concentration, extreme concentration. And especially, and as I showed you in the few ministries, the question is, has this become a political tool? Can it become a political tool? And in the case of Malaysia, the first speaker drew reference to this. When we incurred the pandemic, we also were confronted with a political crisis. And while this GLC government ecosystem was a tool to save the economy, it also became a tool for political patronage, to keep the government in power. As I said, it can go either way. So these are important lessons. But I'll leave that for another day. We don't have time to discuss it. I'm more interested in what lessons can we learn for the good of other countries too. Now, for that, I want to turn to the second issue, which is of my concern, development models, equitable development models. Even before the crisis occurred, we were talking about how many countries, emerging economies like Malaysia, were trapped in the middle income segment, the middle income trap. We were talking about growing wealth and income disparities, referred to by the earlier speakers, and this was leading to new social problems, including young people going and joining terrorist groups. We were concerned with ethnic and gender-based discrimination, serious problems in this throughout the world, and the impact of environmental degradation, the climate change issue, which we have not discussed, but was referred to. These are all serious problems, and when the crisis occurred, interestingly enough, it helped solve some of these problems. For example, even in terms of environmental degradation, we found that the environment was doing much better with the economy in lockdown. It showed also that the GLCs or the state-owned enterprises can be used in a way to address, as I said, certain inequalities, which, if the government acts in a progressive developmental manner, can be extremely good for the economy. So these are important lessons. So what this drew our attention to, and I like to stress this, is that in times of crisis, countries can rise to the occasion. Two countries I'd like to mention: Germany, since we're talking with the Germans today, Germany and Japan. In the post-World War II period, at a time of a serious crisis that they were confronted with, they introduced new development models. In Germany, it was called the social market economy. In Japan, it was called the developmental state. Basically the same thing. What did these models talk about? A compact between state, market, and labor, a coming together of the nation, a forging of the nation where the government, business, and labor unified to bring about a more progressive form of development. And what is interesting is, in the post-World War II period, Germany and Japan, within a span of a few years, immediately became major economies in the world. And let me remind you that these two are democracies. Some of you all may argue this is a more authoritarian type model with reference in particular to China, but we have seen models of development which are extremely progressive, but also democratic in nature. It can be done. It's whether we have the political will to do it. So I'd like to close on this point. If we have state-owned enterprises, which are key players in the economy, can we hold them accountable? Yes, we can. We can hold them accountable by holding the politicians who control them accountable, especially during elections. Parliamentary select committees can be formed to hold them accountable. You cannot do that with private firms. The owners are only responsible, or the managers are only responsible to their shareholders. It's a completely different system, as I pointed out at the beginning. It's time for us to think about this. What kind of new model of development should we move forward now that the crisis has taught us that there are serious problems that we need to address? When there's a crisis, the government has to intervene to deal with social issues, including how to protect people at a time of crisis of the sort that we've just been confronted with. The political economy was forcibly changed. We're no longer just talking economy, we're talking political economy. We are talking now about the way in which the government and the market have to work in a new way. I'm not saying for a minute we negate private firms. In fact, small and medium-scale enterprises constitute the largest segment of the corporate sector in most countries around the world. We have to support that. But at the larger level too, we still have to think about the model of development that we want to have for our country, which will bring about more equitable development. That is the lesson of this crisis. It has taught us that we have tools available that we can use for the good. But this tool, ironically enough, can be a tool which can have a predatory nature. It's time for us to make a choice between the two. Okay, thank you, Nadia.
Very interesting, Prof. That was Professor Dr. Terence Gomez from the Faculty of Economic and Administration of University of Malaya. I'm sure the audience members have a lot to ask. Maybe after this, we have one more speaker before I open up the floor again for a Q&A session. So in the meantime, please do key in your questions through the Q&A box. Now, ladies and gentlemen, our final speaker is Ms. Lilian Fan, who is International Director and co-founder of Good Tenayu Foundation, a regional humanitarian organization based in Kuala Lumpur, Malaysia, and Aceh, Indonesia. She is also the Regional Director of Rohingya Project and Chair of the Asia Pacific Refugee Rights Network's Rohingya Working Group. She is a cultural anthropologist and humanitarian professional with more than 20 years of experience working with refugees, internally displaced persons, and communities affected by conflict and disaster, including in Aceh, Myanmar, Haiti, and Syrian refugees in Jordan, and currently specializes in the situation of stateless Rohingya. Lilian also provides regular expertise to a range of institutions and governments, including the UN, World Bank, ASEAN, the Government of Malaysia, and Government of Indonesia. Ladies and gentlemen, Ms. Lilian.
Thank you so much, Nadia. I'd really like to thank the organizers for inviting me to share some views on this extremely rich and important conference. What I'd like to talk about today is, I think, trying to bring our perspective to the level of the grassroots. I think we've heard a lot of analysis, which has been really important, looking at geopolitical issues, looking, as we heard just now, at some of the macroeconomy and governance issues. And I'd like to take us, in my presentation, to focus a little bit from the grassroots perspective, as we do as anthropologists in my profession, to really try to understand, you know, the way this pandemic has played out in terms of vulnerability when it comes to actual communities. And I won't just talk about refugees, although that's my specialty. I'll talk about a number of different groups. But I think I'd like to start by reminding everybody that today, in fact, is Human Rights Day. So I think it's a very timely and opportune moment as well to discuss the importance of integration of human rights into the type of response and prevention measures that we take for this pandemic. And I think this is something which has been underlined even today by the UN Secretary General, and has certainly been underlined in the past as well by the Director General of the World Health Organization. I would also like to just note on a similar note that today also marks the end of the 16 days of activism, which was basically launched, you know, it's launched every year on the 25th of November for the International Day of the elimination of gender-based violence. I think this is really important, looking at the elimination of violence against women. I think these are some of the issues I'm going to be talking about in my presentation. So let's keep in mind that there are a lot of global standards and a lot of global commitments that have been made, so that while we are talking about, in some aspects, you know, quite a new type of crisis, the approach that we take to dealing with this crisis should not in any way diminish commitments that already have been made by the international community and member states of the United Nations. So I do have a few slides I'd just like to share. Okay, can you see these slides?
Yes, we can.
I'm going to try to put them on in presentation mode. All right.
Okay, great.
Fantastic. So I've sort of framed my presentation in really sort of the theme of looking at how we integrate an understanding of vulnerability and an understanding of how to protect people who are vulnerable and protect human rights in COVID prevention, response, and recovery. And here I have some quotes by our Secretary General of the UN, as well as the Director General. And these are reminders of the importance. And I think that what's really important is that we should not look at, you know, these issues of vulnerability and the protection of human rights as a choice. I think we really need to understand that these are the very things that are going to make our response to this crisis, to this pandemic, and our ability to better prevent against future pandemics effective. And I think this is really important. I think it was raised actually by some of the previous speakers as well, you know, the importance of ensuring that there is equality and fairness in the response at all levels. It's very complex, obviously, because, you know, societies are complex, and there's obviously, you know, varying levels of inequities and inequality of access, for example, to health services, to information. But it's really important that we do work together amongst different stakeholders to try to bridge those gaps as much as we can to actually enhance the safety of all of us. So just here to say that vulnerabilities, of course, existed before the pandemic. But I think what we've really seen globally, not just in Malaysia, has been that vulnerabilities have really been exacerbated because people, of course, we are all vulnerable to being infected by the virus, but we're not equally impacted by it. And I think this is really important to understand. And it's important to understand the details of how specific groups are affected in different ways so that we can try to find ways of addressing those vulnerabilities in policy responses and practice. So just as a little reminder, I'm sure most of you already know this, and I would not like, you know, I think we have to also be careful about labeling groups as being, you know, permanently vulnerable. I think, you know, certainly women don't want to be called, you know, automatically a vulnerable group, but I do think that we need to look at the potential of vulnerability for many of these groups. So, you know, not to overgeneralize, but also to ensure that we're paying attention to signs of actual vulnerability. And this is obviously not comprehensive. This is, it's really a snapshot of certain kinds of groups, but you can see that vulnerability comes in many different forms. You have vulnerability based on age, you have vulnerability based on certain types of disabilities, vulnerability based on, income levels, obviously, on geographic locations of where one lives, languages that one speaks, levels of education, whether one is represented or not within, constitution, within their constituent representation regimes, informal, whether people work in the informal sector or not, whether you have a home or not, whether you have a shelter. This is such a basic thing. And then obviously groups, who have fled from conflict to try to seek asylum elsewhere, such as we have here in Malaysia and in the region as well, refugees, stateless persons, which would include people, people who should be citizens, but somehow have not managed to obtain, valid documents to claim that citizenship, claim that nationality, or groups who are somehow just left out of being documented for one reason or another. Undocumented migrants, I know that this was touched on a bit yesterday, but I think we do need to look at the vulnerability of undocumented migrants as well, and not just look at them through the criminal lens. And also prisoners, as we've seen in Malaysia, certainly in our prisons and in our detention centers as well, there has been a high level of infection of COVID-19 in spite of the best efforts by the authorities. So just some very quick examples. Obviously, I think everybody would sort of know this one, but with the elderly population, there's obviously a higher rate of fatality. And I think the other types of vulnerabilities would be things like the digital divide. I mean, the digital divide is something that's so important, I think, when it comes to generations, when it comes to people from an older generation who have not grown up using social media. When most of your information on prevention and how to access treatment and on SOPs, for example. I mean, even members of my family who are older, don't have Telegram, and they can't get on, they don't understand what Telegram is and how do you get the information from MKN every day, for example. Many people who are, if there are people who are ill, they might be dependent on family or caregivers. And some people who are elderly are also vulnerable to social isolation. Persons with disabilities, of course, disabilities would come in many different forms, but certain types of disabilities, such as, the inability to access particular kinds of information, for example. People are often, persons with disabilities, unfortunately, are often excluded from decision-making. And I think this is a really important issue. How do we reach out to make sure that groups who are usually not consulted are actually being consulted, because we need to understand, number one, people's needs, obviously from a health perspective, but also from an information perspective. What types of information do people need? And I think this is something which, we've done fairly well on. I don't think we've been, that there has been no attention paid to this by the ministries and also civil society. But we could certainly do a lot better, I think, in reaching certain groups. Women, here again, as I said, women are not, automatically a vulnerable group, but I do think we need to understand the specific role that women play in this pandemic as the majority of frontline health workers, the majority of primary caregivers, and also economically. Many women are involved in the informal sector. Many women work from home. Many women are working, in informal jobs. And there's a high level of female-headed households, and I think we've seen reports by UNICEF that actually showed that there's an extremely high level of poverty and households, female-headed households as well, that have fallen into poverty. There is an increased risk of gender-based violence. This is global. This is not just here in Malaysia, but it includes Malaysia. And UN Women has just published reports that actually show these trends. That in certain countries, the level of violence against women that has been reported, and of course most cases are unreported, has increased even 5-fold in certain countries. This is something which we need to actually really look at as an impact it was obviously there before. This is not something that started with the pandemic, but again, it's been exacerbated because of the pandemic. And that is also due to the economic challenges, the loss of livelihoods by many people, and the tensions of these prolonged periods of, having to stay at home. And at the same time, it's a time when services for women, including sexual and reproductive health services, but also services to address gender-based violence, for example, have actually been drastically reduced. Talking about, my favorite issue, which is refugees, I think we need to really remember, sorry, let me go back. We need to remember that COVID has changed many things. COVID-19 has changed many things, but it unfortunately has not ended conflicts. And this is in spite of the UN Secretary General's global call for a global ceasefire, and I think even ASEAN has actually signed up to that, and has really supported that. Our Malaysian government as well has really come behind this call for ending conflict, but unfortunately conflict hasn't actually ended, and refugees cannot return to their countries of origin unless there's peace. So I think this is something that we really need to understand. So we can't actually find solutions for refugees easily at a time when political solutions that are going to start building peace and bringing peace to their countries are not being found. And at the same time, there's been a decrease of spaces for resettlement in many of the resettlement countries. So the majority of refugees are hosted, in fact, by developing countries, and not in the West or in resettlement countries. They're in developing countries, including Malaysia. Malaysia, I think, I think the Malaysian government feels that we have too many refugees. Our number is actually not that large compared to many other countries, but as many countries who haven't signed the convention, number one, and who have our own challenges, our own development challenges, obviously without a framework, without a policy, and without some level of clear responsibility sharing within the region and even within the country, a real framework that brings different actors together, it is challenging. And sometimes the resources are not there. Refugees face challenges, particularly with COVID as well, because in non-signatory countries, including our country, they actually lack legal documentation. The Malaysian government has been very good in recognizing on a humanitarian basis the UNHCR card increasingly, even though it's not considered a legal document. Increasingly, there has been a recognition that persons with the UNHCR card, as long as it can be verified by the authorities, should at least have the ability to stay in the country for a temporary period of time. But it's not a perfect system, obviously, because we still lack the refugees still lack access to basic services. I have to say that the health sector has been one of the best ones in terms of being able to extend access of services to the refugee population. And that's because in general, the Malaysian health sector does not deny people access based on their immigration status. And in fact, for COVID, it was stated very early on, there was a decision that was made that anyone could get tested and could get treatment. And anybody with symptoms, even if you were a foreigner, would be entitled to get free testing and free treatment of COVID-19. And this was a very important policy that was taken. I really do congratulate our health ministry for taking that step. But there are still so many other challenges. And I think with other types of health issues, such as something very basic like pregnancy and delivery of a child, for example. For most refugees, even with the UNHCR card, they can get a 50% discount at a government hospital. But because refugees cannot work legally, it means that most refugees can't even afford the 50% discount. And that's a discount off the foreigner's rate, obviously, not of the local rate. Because of the lack of documentation, refugees are also at risk of, are still at risk of arrest and detention. And we have seen recently as well that there continue to be a large number of refugees, including children, refugees and asylum seekers, I would say. So not everyone who necessarily has the card, but who is a legitimate asylum seeker. There are still people in detention, and including children, hundreds of children who are still in detention until today, even though there are some efforts to try to come up with alternatives to detention. So that's something that could be worked on as well. Quickly, some examples of some measures that could be taken, translation of WHO and ministry materials, and I would include MKN in this, because that's really important, the SOPs for managing the crisis and the pandemic, making sure that those materials are available in languages spoken by indigenous and refugee and migrant communities. I think this is really important. I think we've done fairly well in this, but sometimes it's not just about translating a language into a particular, translating materials into a particular language. It's also about how you disseminate that. So paying attention to how messages are disseminated. For example, the Rohingya language is not a written language. So, there was a lot of effort by NGOs and UNHCR working with the Ministry of Health to try to translate materials into different languages, and lots of them were translated into Persian, into Arabic, into Burmese. But the Rohingya language is not a written one, so you really needed to use audiovisual and voice messages in particular, because not everybody has access to high bandwidth as well. So paying attention to dissemination methods. I think the experience of our frontliners in Sabah also is really a case in point here as well. A lot of the indigenous languages are largely, even if people have a level of literacy, for the most part, audiovisual is actually a much more effective means of communicating to the indigenous communities in Sabah as well. Looking at putting in place gender-based violence and child protection SOPs in all quarantine facilities, for example. I'm not sure if this has been done, I hope it has, but this is certainly something that could be done as an example of a measure that would pay attention to particular types of vulnerabilities and risks. Promoting social cohesion and solidarity. This was mentioned, this importance of solidarity was mentioned by Colonel Dr. Frank earlier. I totally agree with it, and I do think that there's a real role to be played by both the government and civil society in encouraging solidarity in the response. We did that very well in the beginning of the response, I would say, in Malaysia. There was a lot of language around leaving nobody behind. There was a lot of language about, we're all in this together, kita jaga kita. And that language is still there, but I have to say it's been, I think it's reduced quite a bit. And, it's been countered by some other types of language, which has been very unhelpful, certain types of stigma and xenophobia against certain groups. And I will say clearly, so one of the groups targeted here has been the Rohingya, unfortunately. And that type of language is unhelpful. So I think the importance of monitoring hate speech and stigma, not just against refugees or migrants, but against any group, because it's extremely dangerous to let any group be targeted, by stigma. At a time when we should all really be working together in solidarity to make sure that everybody is protected equally. In the longer term, moves like examining universal healthcare system. So Thailand is, I believe it's actually one of the only countries in the world, if not the only country in the world, that actually has an insurance scheme that includes undocumented migrants, which is remarkable. And it's in our region. And I think that, learning from the Thai example, which in fact, started several years ago. This is something which we could look towards. I think it is certainly something very relevant in a country like Malaysia, where we do have such a diverse population, and which includes a lot of migrants as well. And making sure that people have basic coverage is important. It's extremely important even to keep citizens safe. Reframing the new normal, just to basically remind us that the new normal is not just about looking at SOPs, it's about trying to change the way we see things as well. I mean, looking at understanding vulnerabilities, real vulnerabilities, and really understanding the risks that are facing specific communities and specific groups, designing those types of targeted measures, and formulating prevention, response, and recovery strategies that build this understanding of resilience and an understanding of human rights into our responses. To build resilience. Resilience is another word that's been used by several of the speakers today. I think it's extremely important, and we need to bring this back into the dialogue, into the discourse of recovery. We do need a whole of society approach for this. This is not something which can be done by any one actor. So I do really want to emphasize as well the importance of partnership, the importance of complementarity, the importance of working together when it comes to protecting vulnerable groups. And I think on the broader conceptual level, to try to link our understandings of security and make them more complex, so that we are talking about security in a way that brings together security and sustainable development, that we're looking at understanding public health concerns, national security, human security, inequalities, human rights, and good governance in somehow in the same framework. And I don't think it's impossible, because a lot of this has already gone into the Sustainable Development Goals. So bringing that back, the attention to the Sustainable Development Goals, as we are working together to face this pandemic together. Thank you.
Thank you very much, Ms. Lilian. That was Ms. Lilian Fan, who is International Director and co-founder of Good Tayo Foundation, a regional humanitarian organization based here in KL and also Aceh, Indonesia. Now, before I open up the floor for another Q&A session, we do have another poll where we have a question to pose to all of you. It is, has 2020 made your country better prepared for future pandemics? So let's hear from our audience members here on Zoom today. Has 2020 made your country better prepared for future pandemics? As we did hear from a speaker yesterday in day one of the conference, this COVID-19 pandemic will not be the last pandemic. So we need to ensure that we can still be prepared for what's ever to come in the future. So we can probably take a look at the results in just a moment over here. So please do key in your results. Okay, 100% of you has said yes. That's very good news to hear. And we hope, of course, there's plenty of room for improvements to be made and lots of lessons to be learned from this specific COVID-19 pandemic. Now, let's open up the floor for a Q&A session. Prof. Gomez, we do have a question here. It's from Muhammad Khan. The Malaysian model that you briefed can be good to deal with in a crisis like COVID, in mobilizing efforts via GLCs and other companies that have links to the government. However, with this model, you weed out competition that is not linked to the government. So under the Malaysian model, how do we encourage non-government linked companies that may have a solution to offer to stay competitive or survive against GLCs? Prof.
Okay, thank you. That's a very good question. In fact, this was the issue we wanted to debate. If you look at the Malaysian model, since the question was on Malaysia, let me give you some features about the Malaysian corporate sector. 98.5% of the corporate sector constitutes small and medium-scale enterprises. So the GLC world, which I just showed you, and the large firms that I just showed you, privately owned firms too, constitute only a very small segment of the economy, 2%. My concern actually with the GLC world was how do we use the GLC world to support the SME sector, the 98.5% of the corporate sector. There are 1.2 million companies in this country, 98% of the small firms. And out of these 98%, 89% of them are micro firms. That means they have less than 5 employees. This is a major structural problem in this country. The government has to intervene to help these small firms. And how do they do it? They do it using the GLC world. As I mentioned, we have the development financial institutions like the Agro Bank, the SME Bank, the Export-Import Bank. They were all created to support this world, not to compete with them, but to encourage this SME world because it's highly entrepreneurial. And if they're highly entrepreneurial, that will enhance competition. The second point which I want to make is this. We have statutory bodies which focus more on the rural areas too. The agriculture sector. The agriculture sector is very important because we are worried about food security. As you know now, with the food supply chains all gone and Malaysia being so dependent on food imports, what happened to our agriculture sector? Again, this world that I mentioned helps create a vibrant food sector, which will make us also independent of imports. And then we have other institutions like Khazanah. Khazanah was supposed to help promote science and technology development. You saw the importance of science and technology. Small firms, even the privately owned big firms, do not invest in R&D because it's so expensive. The government must intervene to support private firms so that they can move up the technological ladder. But they are not investing, so the government must do it for them. These are all issues we have to debate. I'm not saying that I want to weed out all these private firms and I want to get rid of SMEs. That's not the way we build an economy. Let me give you an example. Among the most industrialized economies in the world include Japan, Korea, and Taiwan. They all have different, as I mentioned, different models, but I like to look at Taiwan. 98% of the corporate sector in Taiwan are SMEs, and the government, through their government-owned banks and through their research-based institutions, have created transfer to the SMEs so that the SMEs can grow. And the Taiwanese SMEs are among the most productive in the world. That's another important point. This world can be used to support small and medium-scale enterprises. Are we doing it? I'd like to end on this point. When we introduced this system way back in 1970, one of the core issues was to redistribute wealth more equitably and to eradicate poverty. Over the past 40 years, poverty rates in this country has reduced. We can question it, but it has reduced. And it has been reduced appreciably from about 65% in 1970 to now the rate is about 16%. Even by critics, it's about 16%. That is a major success story. The system helped create a new middle class, a thriving middle class, as they did in Korea, in Taiwan, in Indonesia, which also has a lot of state-owned enterprises. There's a lot of good that can come out of this. Now look at those countries which is driven by private firms, the United States, UK. What do you see? Serious poverty, serious inequalities. Malaysia has a mixed model where we have mixed both the neoliberal private system as well as the public system. And that's why we see also these inequalities here. There are a lot of problems to be discussed, but we haven't discussed it. When the new government came to power in 2008, the Pakatan government came to power, they were supposed to discuss this and to see whether we can create a more equitable model of development. They didn't, because they knew that this GLC world can be used to consolidate their power base, the political base. When Pakatan came to power, they too were supposed to look at it and use it more productively in the crisis period, but they didn't do it. Why? Because they wanted to use it for their own political interests. I'd like to end on this note. This is not the first time we've been asking about the need to debate this. In 2008, we had a global financial crisis. It brought the world to the brink of collapse, the world economy to the brink of collapse. It was compared to the 1929 Great Depression. When Obama came to power, he talked about a new model of development. In Malaysia, we had a new prime minister. His name was Najib Razak. He, in fact, said, I am going to introduce a new economic development model. Why? Because they realized that the old model, very private sector driven, was not working. It brought the world to the brink of collapse. We needed to debate this. And in both countries, I would argue, Malaysia in particular, we didn't debate it again. Najib may have promised us a new model, but he didn't give us a new model. So we haven't debated this. The crisis today is giving us an opportunity to debate this. We should seize the opportunity that this crisis has given us to revisit this system that we have and refine it and make it more equitably driven.
Thank you, Prof.
Thank you, Nadia.
Yes, we have another question here. It's from Ishak Nazra. I think he has two questions. One, I think the first half I will give to Mr. Thomas. I think, how can middle power be responsible when they gravitate towards the major power? This is observed by the Indo-Pacific strategy of the middle powers, which are in line with the principles of the strategy of a particular power or the composition of the Quad. And how can multilateralism can be said to take a back burner position when 172 economies are now engaged within the framework of COVAX? I think that's a question for perhaps Mr. Thomas to answer.
Sure, thanks, Nadia. Look, all powers, whether small or middle, will inevitably, to a certain degree, gravitate or share values with bigger powers. That is my view of the reality of international relations and the balance of geopolitics. However, there is a lot of space for differentiation, and shared values does not necessarily imply shared aims and shared ideas on how to go about achieving those aims and objectives. The Indo-Pacific is a very, very interesting concept. There is no one Indo-Pacific. By my last count, there are 7 different Indo-Pacific strategies or approaches, and none of them, despite sharing the same name, are similar to the others. The Americans have a rather peculiar one. The Japanese one is slightly more aligned to that. People tend to lump the Australians in that, but I have to disagree. The Australians certainly call for a much more inclusive approach than what comes out of Japan and the United States. You have different iterations of the Indo-Pacific now coming from France, coming from Germany. The Netherlands just released something recently. So despite the similar sounding name, they all have slightly different approaches, slightly different takes on how inclusive they are, how to engage. And it's true, some are certainly, and I would agree that they are very rightly aligned against aligned against China, but not all. And I think how this definition of Indo-Pacific moves on, how this contested definition, by the way, how it moves on and how it continues to be defined, and it's not fixed yet, will very much define the future of this region. Some people in the early years used to, and I used to be among them, I used to dismiss the idea of an Indo-Pacific. I'm increasingly starting to think that the Indo-Pacific might be here to stay for a while. And ASEAN, as slow as the organization is, has also started to realize that by virtue of its outlook on the Indo-Pacific, it's a tentative baby step in that direction. On multilateralism and the back burner position, look, I never said multilateralism was dead, but in the early days of the pandemic, it is when you look at organizations like ASEAN, when you look at organizations like the EU, beyond the general meetings, when you look at the sort of tangible outcomes that were supposed to come out, they were not there. You are only seeing this now from May onwards, especially as you move on. Multilateralism is certainly around, but it took a while, and it should have come faster for all the debates, for all the conversations, for all the meetings. I'll give you ASEAN. ASEAN has a master plan to deal with a pandemic-like situation, and I would be very, very interested to sit down and go through it and do a checklist to see what ASEAN is supposed to do and how fast it did it and how fast it didn't. I had a colleague who was doing that, but I'm not going to steal from his research, but it was very, very interesting. There's a lot to be written about this, especially in ASEAN, but they have come along, in a very ASEAN way, gradually, eventually, finally doing the right thing, slowly. So it's certainly not, it's certainly took a while, but I'm glad that we're finally here. Yeah, I hope that answers your question. Cheers.
Thank you very much, Mr. Thomas. Unfortunately, that's all the time that we have for the Q&A session. So we do have another question, a few more other questions here in the Q&A box. Perhaps our speakers, Prof. and also Lilian, could key in live in this Q&A chat box, because we still do have time, but I need to wrap up the Q&A session. So once again, thank you to all our speakers, Mr. Thomas, Professor Terence, and also Lilian. Now, ladies and gentlemen, before we conclude the MiDAS KAS conference, I'd like to invite Ms. Miriam Fisher, Director of KAS Malaysia, for a few words.
Ladies and gentlemen, dear colleagues and friends, we have reached the end of our MiDAS KAS conference on pandemic response and beyond. First of all, I want to thank all of our panelists for sharing their valuable insights with us today and yesterday. Thank you to our speakers from Malaysia, as well as to our speakers from Germany, who actually got up early to be with us yesterday and today. We thank you for your insightful contributions and for sharing your experiences. I would also like to thank our wonderful moderator, Nadia, for doing such an excellent job at moderating our conference. Thank you, Nadia. And last but not least, thank you to all of you, to all our participants who followed the conference online and from your homes and from your offices, and for asking interested questions in our question and answer sessions. In times where we cannot meet in person, it is especially important that we design these online conferences in an interactive way so that we can still hear from our audience. Don't worry, I will not even try to recap all the things that have been said during our conference, but one thing is certain. the COVID pandemic has taken a heavy toll on all of us. It has revealed our vulnerabilities, our weaknesses to a very devastating extent. It has triggered a socio-economic crisis impacting billions of lives and livelihoods. It has raised security concerns, and it has undermined global stability as well as global solidarity. One of the messages that stuck with me most from this conference was by the representative of the Malaysian Health Ministry yesterday, who said, "No one is safe until everyone is safe." Because we are not in this alone. We are all facing this together. We are all in a shared struggle to protect lives and livelihoods. I would also like to thank the Malaysian Minister for Defense, Dato Ismail Sabri, for his keynote address yesterday and for underlining the great need for increased international cooperation. Because handling this pandemic is a shared responsibility. It is the responsibility of all of us. A crisis of this extent cannot be dealt with solely nationally, but instead multinational bodies and institutions need to be strengthened. That is actually something that has come up today, especially in our conference, that many speakers shared this view as well. So instead of blaming one another, we should work together towards a unified response, and we need to learn from each other. I strongly believe that one of the key lessons learned from the pandemic is the importance of keeping all forms of dialogue and exchange open. A dialogue across all sectors and with all stakeholders. A dialogue across local, national, and international levels. Konrad Adenauer Stiftung will continue to facilitate platforms for exactly such a multinational and multi-sector dialogue in order to enable continuous exchange. KAS remains committed to bringing people together because the more connected we are, the stronger we are. Let me end by thanking our partner, MiDAS, the Malaysian Institute for Defense and Security, for the successful cooperation in preparing this conference. Let us hope that we can hold next year's MiDAS KAS conference in person again here in Kuala Lumpur. I certainly hope that we can do that together, and I look forward to it already. So once again, thank you. Terima kasih. Dankeschön.
Thank you so much, Ms. Miriam, and thank you so much for the opportunity from MiDAS and KAS for having me be part of this conference. I myself have gained a wealth of knowledge. Thank you to MiDAS and KAS for providing this dialogue and platform. Let's keep the conversation going because as we've been told, this is not the last pandemic. And also, once again, thank you to all our guest speakers and audience members who made this two-day MiDAS KAS Conference 2020 possible and a success. With that, I would like to hand over the closing to Ms. Aini. Thank you and see you again.
Thank you, Ms. Nadia Azmi, for your eloquently moderating MiDAS KAS Conference 2020. Thank you, Mr. Gerard George, for being the sole rapporteur for this conference. To all panelists and participants, thank you and danke for sparing some time from your busy schedule to join us today. We hope to see you again next year with another exciting conference. With that, I bid you farewell and auf Wiedersehen.